Your erection is a warning light. When it changes, your heart, and sometimes your brain, may be asking for help years before other symptoms. Don't ignore it. If it's sudden with chest pain, shortness of breath, or neurologic signs, go to the ER. If it's recurring over weeks, get evaluated early and start fixing the foundations. Stay with us. Next, we'll show what ED is telling you, how to tell mind versus blood flow, and the first steps to reverse it. Let's begin.
Welcome to the Deep Dive. We're the show that cuts through all the noise to really give you the essential insights you need. Today, we're getting into a topic that affects so many people, but it's often, kept quiet. We're talking about erectile health. We're going deep on practical action first steps for adult men and partners too on, how to improve erections. Our whole approach here is supportive, no judgment, just steps you can actually take starting today, this week, this month.
Exactly. And our mission for this deep dive is really to pull together a lot of info, medical research, clinical practice, and just boil it down. Clear, actionable stuff. We want to cut through the complexity, give you what you really need to know based on solid sources.
Okay, so let's just jump right in. Erections. At the core, it's really all about blood flow, isn't it?
That's pretty much it. When arousal happens, blood flows into these two special arteries in the penis, the cavernosal arteries.
Cavernous arteries, okay.
Right. And the more blood that gets in there and stays in there, the firmer and longer lasting the erection. It's basically a hydraulic system. Simple idea, but complex in reality.
A hydraulic system. I like that.
Yeah. And here's the really fascinating part, the really crucial insight, is how incredibly small these penile arteries are.
How small are we talking?
We're talking under 1 millimeter in diameter. Tiny.
Wow.
Yeah. And just for comparison, your coronary arteries, the ones feeding your heart, they're about 10 times bigger.
10 times. Okay, that's a huge difference.
It really is.
Yeah.
And because they're so small, these penile arteries are super sensitive to anything affecting blood vessels anywhere in your body. So difficulty with erections often shows up first. It can be like an early warning system, a canary in the coal mine for bigger health issues down the road, sometimes years before.
That canary in the coal mine idea, that really hits home. So if someone's experiencing ED, what does that actually mean for fixing it? If these tiny arteries are signaling something bigger, then improving things isn't just about like a local fix, right? It's about the whole system.
Exactly. It's holistic. Anything that helps your overall blood flow and nerve function is going to help improve rigidity and duration, which leads us right to the first practical step. There's a bit of self-assessment.
Okay.
Because you need to get a sense, is this leaning more psychological or more physical or, like you said, maybe a mix that really guides what you do next.
Right. But how do you even start to figure that out? It feels pretty personal. What are the clues?
Well, the sources give us some pretty clear pointers. Let's talk psychological first, or psychogenic ED. A key sign here might be if you still get good morning erections, when you wake up. Clinicians call it nocturnal penile tumescence.
NPT. Okay. Morning wood, basically.
Basically, yes. Or maybe erections are fine during masturbation, but the difficulty really only pops up during intimacy with a partner. That pattern often points towards things like performance anxiety, stress, maybe depression. It's situational, driven more by the mind.
Okay, so it's specific to certain situations. What about the other side? Physical.
Right, so physical or organic ED. That usually means a more consistent lack of firm erections across the board, including not having those morning erections. This pattern is much more likely linked to actual underlying health stuff impacting blood flow or nerves.
And like you said, it can definitely be both acting together. Some physical issue might be there, but then anxiety about it just makes everything worse.
Precisely. It's often a tangled web.
Okay, so if anxiety is a big part of the picture, what can someone do right now, those immediate performance tools?
Great question. One big thing is breaking that anxiety loop. Think about slow, controlled breathing.
Just breathing. Seems simple.
It sounds simple, but it's powerful. It activates your parasympathetic nervous system. That's your rest and digest system. It helps calm you down, shifts blood flow away from the stress response, back towards where you need it for arousal. Something like 4-7-8 breathing can make a real difference. Inhale 4, hold 7, exhale 8.
Okay, 4-7-8, worth trying. What else?
Cognitive reframing.
Yeah.
Basically changing your focus. Instead of worrying about will it work or the erection itself, shift your attention. Focus on connecting with your partner, the sensations, the shared pleasure, the whole experience.
Getting out of your head, essentially.
Exactly. And that leads into arousal tuning and sensate focus. It's about prioritizing feeling good together, exploring sensation, not just focusing on intercourse or erection quality. This really needs open communication, saying something like, hey, let's just explore and enjoy touching, no pressure.
Takes the pressure off.
Totally. Experimenting together adds novelty, too. It can actually lead to stronger orgasms for both partners. For example, some studies show that pairing direct clitoral stimulation during intercourse, maybe with a hand or a toy, makes it more pleasurable for maybe up to 70% of women. And boosts their chance of orgasm. It's about being present, exploring together, not just aiming for one specific outcome.
That shift from performance to partnership sounds crucial. Okay, so those are things for right now. What about building strength for the long haul? The body tools for this week, this month?
Right, building that foundation. First step, pelvic floor training.
Pelvic floor? Like Kegels? I thought that was mainly for women.
Often thought of that way, yes, but incredibly important for men too. You got to find the muscles first. Try stopping your urine flow midstream. Or tighten like you're trying not to pass gas. That's the muscle.
Okay, I think I can picture that.
Good. Once you've got it, you train it consistently. The sources don't give exact sets and reps, but the key is making it a regular habit. And just briefly, there's also the opposite reverse Kegels. That's about consciously relaxing and gently bearing down with those same muscles. It complements the tightening.
Interesting. Okay, Kegels and reverse Kegels. What's next for body tools?
Next is aerobic and resistance routines, regular exercise.
Standard advice, right? Good for everything.
It is standard, but let's connect it directly. Better cardiovascular health means better blood flow everywhere, including those tiny penile arteries. Strengthening your heart isn't just about avoiding a heart attack. It's actively helping pump blood where it needs to go for a good erection. So aim for consistency each week. Get your heart rate up, build some muscle. It all helps.
Makes sense. Exercise is non-negotiable. Anything else for the body?
Yes, absolutely critical. Your sleep checklist. Don't underestimate sleep.
Sleep. Why is that so important here?
Quality sleep is when your body does major repair work. It naturally boosts testosterone, which plays a role, yes. But it's also vital for regulating hormones and overall recovery. Think about optimizing your sleep. Some sources mention things like smart mattress covers that control temperature, track your sleep stages, heart rate variability. Some can even help with snoring. There are reports of people getting like an extra hour of quality sleep per night with tech like that. If your sleep is poor, it impacts everything, including erections.
So sleep quality is a big lever. And just to circle back on something you touched on, is ED just part of getting older?
Great question. And no, it's not a normal part of aging itself. Yes, the chances increase as you get older, maybe 40% at 40, up to 70% at 70, but it's mainly linked to those underlying health issues we talked about, especially blood flow problems, not just the number of birthdays. Lots of guys in their 70s, 80s have perfectly satisfactory erections.
Good to clarify that myth. Okay, so we've covered immediate tools, weekly, monthly body tools. What about daily choices, those lifestyle levers?
Huge impact here. Let's start with diet, and let's bust a myth right away. No single food or drink is a magic bullet for ED.
So no miracle erection smoothie.
Haha, afraid not. But what does work is overall heart-healthy eating. Think Mediterranean diet or the D-8 diet. Lots of whole foods, vegetables, fruits, lean protein, healthy fats. These eating patterns are proven to improve blood flow and heart health, which, as we know, directly helps erectile function. It's the overall pattern that matters.
Makes sense. Diet is foundational. What else?
Weight. This is a big one. The link between obesity and ED is really strong. Something like 80% of men with ED are also obese.
80%. Wow.
Yeah. Excess weight often goes hand in hand with high blood pressure, high cholesterol, diabetes, all things that mess with blood flow. The good news is even losing a moderate amount of weight can make a significant difference in improving erectile function. So setting a realistic weight loss target is key.
Okay. Diet and weight. What about substances? Alcohol, smoking?
Crucial area. Substance guidance is vital. These choices have direct, often negative effects. Take alcohol. Too much damages blood vessels, restricts blood flow, and the stats are stark. About half of men with ED also struggle with alcohol addiction.
Half. That's significant.
It is. And nicotine from smoking. Same story, different substance. Damages blood vessels, reduces flow. Roughly 60% of men with ED smoke. Recreational drugs too. Cannabis, cocaine, amphetamines. They can harm blood vessels, limit blood flow. And here's a sobering warning from the sources. Long-term damage from these substances, the poor blood flow, can actually lead to scarring in the penile tissue and potentially even reduce penile length over time.
Reduce length? That's alarming. So these aren't just temporary effects.
They're not necessarily. Long-term use can cause lasting damage. It really underscores the impact of these choices.
Definitely a powerful motivator to make changes. Okay, let's shift gears slightly. What about medications specifically for ED, like PDE5 inhibitors?
Right, PDE5 inhibitors. Generic names you might know are sildenafil, tadalafil. Their purpose is pretty straightforward: increase blood flow to the penis.
How do they do that?
They basically help relax the smooth muscle tissue around those penile arteries. Think of it like opening a gate wider. This allows more blood to flow into the cavernosal arteries and, importantly, helps crap it there, which leads to a firmer, longer-lasting erection.
Okay, so they work on the blood flow mechanism. What are the main precautions people need to know?
Super important point. These are prescription medications. You absolutely need to get them from a doctor and use them only under their guidance. They aren't right for everyone, and a doctor needs to check your overall health, other meds you're taking, potential interactions, all of that. Definitely don't just buy them online or try to self-dose.
Got it. Prescription only, doctor supervision. And what about all those supplements you see advertised?
Yeah, be really careful there. Most special formulas lack strong scientific evidence. Supplements are largely unregulated by the FDA, so you often don't even know what's really in them. Stick to proven approaches. And while we're on meds, it's worth repeating. Many common prescription drugs can contribute to ED. Over 200, actually. Things like antidepressants, blood pressure meds, diuretics, anti-anxiety drugs.
So if you suspect a medication might be involved,
Talk to your doctor. Definitely don't just stop taking prescribed medication on your own, but have that conversation.
good advice. Okay, this really reinforces the idea that ED is often a signal, which brings us to, when should you definitely seek professional help? When is it time to call for backup?
Absolutely. There are definite red flags. If ED is a new thing for you, or if you consistently don't have those morning erections anymore, that's a clear sign to see a doctor. Also, if you're taking one of those medications known to potentially cause ED, like we just discussed, get it checked out. But again, talk to your doctor before stopping anything.
Don't stop meds on your own. Got it. Other red flags.
Yes. Any symptoms of Peyronie's disease that's like a curvature of the penis or pain during erection, or if you've had any kind of pelvic injury or surgery in the past, these all warrant a professional evaluation.
Okay, so when you do go see a doctor, what kind of baseline health checks should you expect or maybe even ask about?
This goes back to the canary in the coal mine idea. It's critical because ED can show up 5, even 10 years before a major cardiovascular event like a heart attack or stroke.
5 to 10 years earlier.
Yes. The risk level associated with ED is similar to smoking or having a family history of heart attack. It's serious. So everyone with ED should be screened for cardiovascular risks.
Wow. Okay, so what does that screening typically involve?
They'll definitely check for hypertension, high blood pressure. Remember, about 40% of men with ED have it. They'll check for dyslipidemia, that's high cholesterol. That number's even higher, around 70% of men with ED. That plaque buildup in arteries directly impacts penile blood flow. They'll check for diabetes, which affects about 30% of men with ED.
Hypertension, cholesterol, diabetes. The big three for heart health.
Exactly. They might also check testosterone levels. About 20% of men with ED have low T, but it's usually not the main driver. Often there's separate issues needing separate attention. Screening for depression is also standard. Affects about 30% of men with ED. And checking for BPH enlarged prostate with urinary symptoms, LUTS, that affects about 40%. And finally, a really thorough review of all medications and supplements you're taking.
That's a comprehensive list. It really shows how ED is tied into your whole body's health. Okay, before we wrap up with the action plan, let's hit a few quick FAQ-style questions we often hear. Just rapid fire. Does ED cause infertility?
Directly, no. But it makes conception harder, obviously. They do share risk factors, though: diabetes, alcohol, smoking, etc.
Got it. What about caffeine? Does that affect things?
Unlikely. Big studies haven't really found a link, positive or negative.
Tight underwear. Boxers versus briefs?
Nope. Standard underwear doesn't cause ED.
Okay. And cycling. Heard that can be an issue.
Not cycling itself necessarily, but too much cycling or an improper bike fit can put pressure on nerves and blood vessels down there. That could lead to temporary or even chronic ED. So proper saddle choice, good posture that helps reduce the risk.
Good practical tip. All right, that clears up a lot. So, as we've been saying, this is all about action. To help you put this into practice, we've actually put together a quick start pack based on everything we've covered.
Yeah, we wanted to make it super practical. So in the pack, you'll find a one-page cheat sheet. Just the top 10-14 key action steps you can take right away. There's also a troubleshooting flow chart, like 6 or 8 steps to help you kind of self-triage between the psychological and physical factors we discussed, and a simple weekly plan template. It helps you integrate the exercise, the pelvic floor training, and those sleep optimization tips. Plus, we've included the FAQ list from today for quick answers.
Sounds incredibly useful. It's all designed to give you that clear roadmap, help you take control of not just erectile health, but really, as we've seen, your overall health. So, wrapping this all up, what's the big takeaway? I think maybe the most powerful idea today is that your erections, they're not just about sex. They are a really potent early signal about your total health. Taking steps to improve ED is often, fundamentally, taking steps to improve your entire well-being. It's almost like an invitation to live healthier.
And that really makes you wonder, if your body is sending such a clear signal through this one area, what else might it be trying to tell you? Makes you think, doesn't it?
Definitely does. Thank you so much for joining us on this deep dive.
And just remember, everything we've discussed is for educational purposes only. It is absolutely not a substitute for professional medical advice or care. Please consult with a qualified healthcare provider for any health concerns.